Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. You know, we've all heard reports that olive oil is good for us based on various studies published over the years, but the Food and Drug Administration had been reluctant until recently to allow manufacturers of edible oils high in the monounsaturated fat oleic acid to put a claim on their packaging to espouse sort of the health benefits of oleic acid or monounsaturated fat. Well, on November 19th, 2018, the FDA officially gave the green light to manufacturers of edible oils containing high levels of the monounsaturated fat oleic acid to place a label claim on their products, which now states, or can now state, supporting but not conclusive evidence suggests that daily consumption of about 1.5 tablespoons of oils containing high levels of oleic acid, where the concentration reaches at least 70% of the fats consumed in the oil, may reduce risk of coronary heart disease. So this claim is based on the fact that 6 out of the 7 studies reviewed by the FDA showed that subjects randomly assigned to consume diets containing oils with high levels of oleic acid as a replacement to fats and oils that were high in saturated fat experienced a modest lowering in their total cholesterol blood level and their LDL cholesterol level. LDL is the bad cholesterol, compared to those who ate a more Western-style diet, which is higher in saturated fat. So to better understand this, it's important to know that there are 4 families of fats that are found naturally in foods that we eat. So they include saturated fat, polyunsaturated fat, monounsaturated fat, and a special type of polyunsaturated fat known as the omega-3 fats. And we all know that omega-3 fats found in fish and fish oil and flaxseed oil provide a multitude of health benefits. We also know that foods that are high in saturated fat increase cholesterol levels, make our blood sticky, and increase inflammation in the body, all of which increase the risk of heart and vascular disease. Now, the most common polyunsaturated fat found in most vegetable oils is linoleic acid, which is a controversial fat, and some studies show that it increases inflammation in the body as well as cancer risk and may increase the stickiness of our blood. Now, as an alternative to linoleic acid is the monounsaturated fat oleic acid, found in high amounts naturally in olive oil, canola oil, avocados, and in many nuts. Now, numerous studies over the years have suggested that oleic acid can suppress inflammation, may help reduce cancer risk compared to polyunsaturated fats like linoleic acid and arachidonic acid, and is beneficial for heart health. As such, many manufacturers of sunflower seed oil and safflower seed oil and soybean oil have created technologies to increase the amount of oleic acid and reduce the amount of linoleic acid in their edible oil products. This was largely due to sort of consumer demand for wanting higher levels of oleic acid or monounsaturated fats in the edible oils that they consume. Now, after reviewing the key studies on fats and heart disease, the FDA finally granted permission for these companies to display this heart health benefit claim on their label and packaging. So the edible oils that now qualify for this reduced heart disease risk health claim include the following: olive oil, high oleic acid sunflower seed oil, high oleic acid safflower seed oil, high oleic acid canola oil, high oleic acid soybean oil, and high oleic acid algal oil. The health claim is intended to inform consumers that according to credible evidence, these products may reduce risk of coronary heart disease when substituted for other fats in the diet, especially foods high in saturated fat such as butter, coconut oil, palm oil, creamy salad dressings, lard, and so on. Not only does oleic acid from these oils help to lower cholesterol, but other studies also show that compared to saturated fat ingestion, oleic acid also increases insulin sensitivity, helping to prevent and better manage diabetes and prediabetes. It reduces inflammatory chemicals released in the bloodstream. It helps to prevent important steps in narrowing of the arteries, and it also improves blood circulation to the heart and internal organs, something that we call improved endothelial function. So for many years, I've recommended that individuals substitute high oleic acid foods and oils for foods high in saturated fats and trans fats, and the evidence continues to show the importance of adhering to this very simple health strategy. So I hope you'll take this into consideration when you're making salad dressings, sautéing or browning foods, or adding an edible oil to any dish. I've provided the references for this information in the text below. Thank you for watching, and I'll see you next time.